Hi, I'm Dr. Steve Newman, Executive Chairman and Chief Medical Officer of CentraForce Health. I'm excited to be with you today to bring you information about the solutions that CentraForce Health offers that change the way you deliver care and improve your business performance. Provider CEOs tell us that the implementation of our solutions changes everything about the way they do business. For example, our service line expansion solution helps to identify where opportunities are to grow market share, how that's segmented by payer type, how to reach those particular patients, and finally, and very importantly, how to allocate capital within the provider system, which is limited, so that they get the biggest bang for the buck, and to overlay this entire new fund of knowledge and insights you get are our engagement and communication channel preferences. So you as a hospital or large healthcare provider or even an ACO have a daily repeating challenge to improve communication with your patients. The reality is most providers use the same communication medium for each campaign or outreach. The reality is that within a market, there are groups of individuals located in different geographies that prefer different media for outreach. The media they trust the most, the media they're willing to take action as a result for. So if you want to activate patients to come to a breast cancer screening, our solutions can tell you how to specifically target and activate that population, therefore bringing those individuals to your screening and improving your service to the community. So you as a large provider, a hospital or a health system in a market have a never-ending challenge of trying to figure out how to improve the effectiveness and efficiency of your communication. So you can spend a lot of money on TV, and we know that's not targeted. What you want to do is to pinpoint the medium that you use, the messenger through it, to activate the specific population that you want to have to respond to your outreach. So let's say you as a hospital or health system want to improve the success of your prostate cancer screening program, but you don't know how to do that because you're told that you should always use text messaging to males in your geography. The reality is, with the CentraForce Health unique engagement communication channel preference scores, you know how to focus your outreach based on payer type and geography. So within your market, from zip code to zip code, you may find differences in what is the most effective way to activate male patients to come to your prostate cancer screening program. With CentraForce Health's proprietary engagement and communication channel preference scores, we can give you information on your patient's unique affinity for certain messengers. For example, we have messages that come from physicians, messages that come from nurses, other ancillary healthcare providers, and interestingly, messages that come from pharmacists. And our clients are frequently amazed at the amount of trust that individual patients and members put in their pharmacist in terms of trust and willingness to take action as a result of a message from a pharmacist. So many health systems do outreach with administrative personnel or a nurse. The reality is, without the unique insights from CentraForce Health's engagement and communication preference channel scores, you don't know which messenger is likely to send a message that will activate your patient. If you send a message from the wrong messenger, you are unlikely to get an optimized activation on the part of your patient or member. That costs you dollars because they will not respond with the activity that you need to improve their health care and therefore will drive up the cost of care to your system. At CentraForce Health, we refresh our engagement and communication channel preference scores every 6 months. That's important to you as a provider or a payer because we know not only the preferences of the existing population change, but their migratory patterns in and out of those geographies that change the mix of patients in different zip codes and therefore change the preferences of that group. That means you need to adjust the medium that you use to communicate with patients of a certain payer type, age group in an individual zip code. Thanks for watching our video today. If you found it interesting, please go to our website where you can see our new white paper that was recently published, and it'll give you more information on our solutions.